Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hey everybody, how are you? Welcome back to the Behavioral Corner. Me, your host and guide, Steve Martirano, host and guide. It's easy to be a guide on a corner. You really don't have to go many places, which I love it. We're real pleased about this program today, and I'll tell you why. This is our 50th edition or episode of the Behavioral Corner, and we wanted to note that because, be honest with you, we're kind of happy with the way it's working. It's building, and podcasting was a brave new world for me. I'm an old warhorse from broadcasting, but podcast was a new deal. So a year ago, we got the pivot over to the wide world of podcasting, and none of it, incidentally, would have been possible without the tremendous support of our partners and underwriters, Retreat Behavioral Health. I don't want to belabor this point, but they, as I say, not only provide the finances for this operation, but they provide their passion, their expertise, their people, their knowledge about behavioral health, and without whom none of it would have been possible at all. We want to acknowledge that right up front, and welcome to the program, the main guy, Peter Schorr. Peter is the founder and CEO of Retreat Behavioral Health. He has been with us many times on this program. No, I think this is his first time on the corner, but he's been on the other show lots of times. And Peter and I are joined by his strong right arm.
He's a lefty.
Left arm, Chief Operating Officer Ken Kosza. Hello, guys, and welcome to the 50th edition of the Behavioral Corner.
Well, thank you very much.
Believe me, I haven't had this much fun.
Thank you for that wonderful introduction.
Yeah, I do want to make an additional point so people understand. When I came to Retreat through Ken, who I knew from a previous life, and when I approached anybody about this idea for a show about substance abuse and treatment, it wasn't because I had any expertise in it, but I ran into a bunch of guys who did. And I thought, well, you know what? This is a radio program here. Nobody's talking about this. And they weren't. So we launched it. But it was believe me, I believed in my bones that I was never going to get anybody to do this with me, because I kept saying to people, it can't be an infomercial. If it's about call this number right now, we'll save your life, I don't want anything to do with it. I would tell him. And Ken was first in line to go, not only do I understand, but I got a guy that'll absolutely believe in that. And that's what the best thing, in addition to money and support, the best thing was that Retreat and Peter and Ken buy into the ideas. This has to be informational, and it has to be about people and informative, so that they stand ready to help you, but they're not in any way ever said we're the only people that can help you. So I'm eternally grateful for that, and I hope the audience is starting to understand that there are people like Retreat out there that can be trusted and actually can help. They have grown over the 6, 7, 8 years now we've been together enormously. They have facilities in southern Florida. They are up in the Lancaster County area with an outpatient facility and a residential facility, satellite offices in various places in the state of Pennsylvania and southern Connecticut as well, with a new facility up there. These are good people. They do good work. Peter, for me, the biggest, change, I should say, it's not really a change, occurred within your business, your company, when you didn't pivot so much, but expand your portfolio of services to include freestanding mental health treatment through Retreat. And therein was born Synergy, which is your healthcare arm of Retreat. Tell me about Synergy a little bit, and why, because you made this move well before the pandemic.
Oh, yeah.
But it now seems really forward thinking because we have a mental health crisis in addition to a substance abuse crisis. Why did you make that pivot?
Well, we've always treated the mental health aspect of it. We just weren't licensed for it. We couldn't bill for it and get paid for it. But we believe that if we didn't really delve into what the patient's problems are, it'll just be a revolving door. A lot of times substance use disorder is a symptom of mental health. And we've seen that in our industry. I know Ken and I've been in it a little longer than Ken, but Ken's been in it a long time now too. He can't say he's a rookie anymore, that's for sure.
I can definitely say I'm in my 30s now.
Yeah. No, not even that. You've been in the business a long time. We've seen changes. We've seen changes in patient profiles on how patients are these days. And we've seen a big spike in mental health issues. First we saw it in Florida. We just in our meetings of our leadership team of how do we see such a sicker population. The drugs are different. And that's really what's caused a lot of it too. It's not like it was, 30, 40 years ago where heroin was 15% purity. It got up to 85, 90% purity before it changed altogether and became something else. And it became something else called fentanyl that was brought in from China that's killing everybody in our country. And it's killing them. People know if you have an addiction problem and you know that what you're doing can cause you to die, that's a mental health issue. That's something we have to look like. Are you trying to kill yourself, or is it something that you're doing on purpose, or is it something you just have no control over? So having our synergy program and using the word synergy just meant a lot to us because when you use the word synergy, a lot of things have to have synergy within itself. So it's something that we thought was a great name for our program. It's taken off tenfold of what we thought it would be. I mean, we've increased our bed count in both our facilities in Pennsylvania and Florida like 3 or 4 times already. We've had to add more beds to the mental health side of it. It's a little different than we're used to on dealing with addicts, where you're dealing with just a mental health issue. They don't even have addiction problems. A lot of people have come in. They're there just for their mental health issues. And, it takes a lot of resources to do that. It takes a lot of folks who are there, doing their daily jobs, but now they got to focus on, sometimes a patient has to have a one-on-one the whole time they're there. So, we have to staff up for that. We have to try to make it as safe as possible. Unfortunately, and when you're dealing with mental health issues, you're dealing with a lot of despair, a lot of death, a lot of different things that get into the mix of it. And we have to be prepared for that. We have to be ready for that. We have to have a staff that understands that. When we had a staff before, we're dealing with addiction problems. I mean, we also delved in the mental health issue, but not like we do now. So now, a lot of questions staff asked when we were doing this is, people are going to be tied up, is this and that. We're not a lockdown psychiatric facility. That's not what we are. That's not what we intended to be. We intended to provide services for our patients that really need to go above and beyond the addiction piece. And I think that we're doing a phenomenal job with that. And kind of, seeing it on the inpatient side was one thing, but on the outpatient side is really where you make a big difference. And that's the reason, is because the inpatient side, you're kind of at the mercy of the insurance company. How long is a patient going to stay there? Could be 5 days, it could be 30 days, it could, whatever it is. But on the outpatient side, now you really can get into some work because they could be there for years, especially on the mental health side. We have psychiatrist staff, we do MAT, medically assisted treatment. There's a lot of different aspects that go into an outpatient facility now when we have all these different services, not just substance use disorder, it's mental health services too, family counseling. There's a lot of components that go in it. I think that, and you said before, and where we never want to be an infomercial for retreat. I think what we're doing is paving the way for other facilities to see what we're doing to make a difference. And we want to bring people. We want people to do what we're doing. We can't treat every person in the United States. And that's not our intention. But our intention is to do the best job we can do, be a model, and then other facilities can see, wow, look what they're doing. Maybe we need to step it up a little and we can do a little better service for people because people are sick. we haven't talked about the pandemic, but the pandemic has caused a lot of mental health issues, a lot of substance use disorder issues, because people are home and stuck and get in their own heads and have nothing else to do. So there's a lot. The world has changed drastically in the last year and couple of months where we've been going through a pandemic, but we started this before the pandemic, and it's something that's taken off during it, but it's something that's going to be on when the pandemic's over. This is something that's a very, very valuable and needed service for the community.
Yeah, it was an extraordinary move you guys made, because I hear you when you say your staff had a whole lot of questions, and I'm sure the industry stood back and went, "What are they kidding? They don't have their hands full enough with substance abuse people. Now they're going to treat mental health cases." It was just inspired, and something that I'm sure you would have done without the pandemic. But you said the pandemic has exacerbated that problem for sure. Ken, with regard to expanding services to include that area, who were the people, who were the stakeholders someone like you had to convince that this is what we're going to do, and here's why we're going to do it? Who were they?
Right, that's a good question. So for us, and you talked about it earlier, we're blessed to work for an organization that from the top at Peter, they understand the climate of behavioral healthcare, right? You're not speaking to some foreign bankers that don't understand where things are going or the trends that we're seeing or what's happening in healthcare. So they're already in tune. So it's not rocket science to say when 85+% of your patients have mental health issues, that this is something that we need to talk about, right? If we want to provide the best care to these folks, how do we do that, right? And then the question is, well, how do you treat folks that only have mental health or only have substance use and are not duly diagnosed? Because really those end up becoming the forgotten patient, right? Is the folks that are just dealing with one or the other. The vast majority are duly diagnosed, both on the mental health side and on the substance use disorder side. So this is the conversation with the key stakeholders, Peter, really to get him to understand, which he already does, that this is what's happening. Once you do that, then it's a conversation with key stakeholders within our organization on how prepared are we to do this, and are we capable of getting it done, right? You brought up the pandemic. On the flip side, the pandemic, we didn't get to have that conversation, did we? We didn't get to have the conversation to say, are we ready for telehealth? Are we ready for Zoom? Are we ready for all these changes? They just happened. So we were blessed that we are innovative in our approaches so that we're hopefully one step ahead of things that do happen. So the key stakeholders are our medical directors, our directors of nursing, and the key clinical people within our system that we sit down with our psychologists and figure out, what are we going to do here? How is this going to work? And what's the best approach to take clinically for our patients? So there's exhaustive conversations about that.
Yeah, you know what I've seen, and the pandemic it was really the backdrop against which we're going to discuss all this stuff, because while it presented enormous challenges and some horrible consequences, there were opportunities here.
Absolutely, no question.
To get better at what we all do.
Right.
Peter, and again, at the risk of sounding like I'm blowing smoke here, I'm not. The people you have around you are hired, I'm sure, for their professional expertise, but you seem to me the kind of boss who looks for people that can think on their feet. You're open to any, you never know where the next good idea is going to come from. So talk about hitting the ground running. One of the first questions I asked you guys, not you personally, but people in the dawn of this thing, in the dawn of the pandemic, it occurred to me one day, well, this isn't strictly speaking something about substance abuse, but they have a facility where they're providing a healthcare service to a group of people under their guidance. They're in a building. What preparations are they making? I mean, do they have protocols? How could they possibly have protocols? And you have in my view, one of the great healthcare professionals working for you, Melissa Callahan, your chief of nursing, really was out front on this thing.
Yeah, she definitely was. She was. I mean, every day she had a health tip. It feels. I don't know about you, kid. It feels like a different world than it was when it started in a year ago March. We progressed a lot more than we led on to, because Kenny and I are in Florida. Florida, you feel like there's never been COVID, but
Right.
we know what's going on in the world. I mean, we're not stupid, but it really has changed a lot, and we've really kind of progressed in at Retreat on how we've started when the COVID started. When we first started, Ken will tell you, we had an outpatient facility. Now you got to close outpatient. You can't have people coming here. What do you do? So in 24 hours, you start a virtual healthcare business. So patients still need to get treatment, still need to be seen. They still need to talk to people. So literally in 24 hours, we started a new business. That we had no idea what we were doing at first. We didn't know what Zoom was. What the hell was Zoom?
Yeah.
Now Zoom has become, an entity in itself, and now people are getting Zoom fatigue. There's so many different aspects of it. There's positives.
Right. There's opportunities that have come for sure.
Last year, every year we have a leadership conference where we take. How many were this year, Kenny? It was 23 people, right? 22 people. Yeah, I think it was 20. But a year ago, when we did it before we opened Connecticut.
We're on the Zoom.
Yeah, but a year ago, before we opened Connecticut, we talked about how we would utilize technology. It's something that's important to grow as a company. Number one is how you're going to utilize technology. In our industry, how do you utilize technology? We talked about it. We talked about a little different things that we wanted to. We didn't know 2 months later we had to hit the floor running and have to understand technology a little better. And it's something that's it's growing and growing and growing. But that happens so quickly. And I think as an industry, not just Retreat, I'm going to say as an industry, we really did a good job in understanding that we have to be quick. We can't sit back and wait for someone to tell you what to do. You got to do it. You gotta do it quick.
Let me ask you that about the technology, because this is interesting to me. What if you hit the ground running? Who knows Zoom? Who knows telemedicine? The word didn't even exist 13, 14 months ago. Do you think
telemedicine did? We knew telemedicine.
It's interesting that you say that, Steve. I think that's a point where you said earlier, where sometimes these difficult times create opportunities. We could have a whole nother meeting about coding and billing codes and how they affect innovation in treatment, right? There are awesome opportunities for access. And that's really what all this comes down to. When you're fighting a pandemic or an epidemic or a mental health crisis, it's about access and quick and efficient access to care for folks. So there's been these opportunities that we've talked about even previously, and all of healthcare talks about. Telemedicine is a thing. And it has there's really key spots within a patient's life cycle where there's opportunity to use virtual health to make a big impact, right? And things kind of get put off until something happens where we have no choice.
So it's less a question of it didn't exist, but it was underutilized and not appreciated
because
until the emergency.
Well, it was
coding. It doesn't exist.
Right. It was a growing industry, virtual healthcare. But not what we do, because ours is a little different. Ours, on the individual counseling, you can do things like that, but you're talking about groups. You're talking about, people having health and physicals online. I mean, there's a lot of different aspects of it that we had to utilize that wasn't there before. And we've kind of tried to be innovative in saying, why don't we get licensed now for having virtual because I understand the concern. The concerns are that if we have a group and we're licensed in Pennsylvania, now someone comes from us from Indiana, they come to us and then they go back home and then they utilize our outpatient through virtual. It's not fair to the therapist that's in Indiana who's licensed in that state, and now they're not going to have access to a patient that's going to a different state that's not licensed in that state. That's not fair. And we understood that. We see that. And we understand the concern. So as an industry, as regulatory agencies, they got to figure out how do we get there? Because this is the wave of the future. Someone who's stuck, who's not mobile, can't move, now this is a way they can connect to a therapist. Someone who lives in a very rural area, but they do have Wi-Fi. This is something that they can connect to a therapist. It's something that really opens up a lot more mental health counseling, substance disorder counseling, a lot of different things in the medical field.
Yeah, it's remarkable. The more I read about the pandemic and the history of pandemics, I go back to this notion that there's great tragedy, great deaths, but often the outcome of something like this can lead to something great, innovative, and tremendously helpful.
Urgency,
So
right?
certainly that's
We
the
need
case.
urgency to make change, right? We need urgency to make change. If we feel comfortable and complacent, we're not trying to change.
Yeah, and the the great example I read was the Black Death, the bubonic plague of the 15th, I guess, century, killed a whole lot of people, but the Renaissance followed, a flowering of everything, and it came out of the necessity of having to change because of this disease. So it's good to see that that's happening in behavioral health. I can speak personally on it as a communicator.
Yeah.
One of the things that happened when we launched the podcast under the banner of a behavioral health situation, a pandemic occurs which affects literally every aspect of our lives. Suddenly the area that we could open up this show to, we have some strange guests. If you look at the list, you go, well, what's that guy have to do with behavioral health?
That's the whole point, isn't it? I mean, isn't that the whole point? That's been the point of the show since the beginning, Steve, is that community is conversation. And this idea that behavioral healthcare is supposed to be, I think of the psych hospital, that's like a 3-mile long road to get to this beautiful old building, and it's hidden and nobody knows what's there. And you think, is that an old ancient mansion or is that a psych hospital or what is it? It's conversation, it's community, it's engagement, we need to talk, it's every aspect of our life is affected by these issues. And I think the pandemic, right, has shown that to be true, that you can't get away from behavioral health care. Your mental health is so important. And when it struggles and you're not giving it the time it's due, look at the impact that it has on our society, even during a pandemic, even when there's significant medical crisis happening.
What we like to say around here is that, if a definition of behavioral health for the layperson, I think, is the decisions you make, choices, the behavior you exhibit on a day-to-day basis has an impact on your mental, physical, and spiritual well-being. So we're going to talk about a lot of different people, a lot of things they do, and how it affects us all. And the pandemic has brought it all into incredibly sharp focus for us.
We talk about pandemic. The difference between this pandemic and previous ones is how it gets broadcast throughout the world, and everyone knows about it.
Social media.
Before, if there was a pandemic
Facebook
in the 15th century, it took years to find out there was something that happened in Cleveland, let alone wherever
they weren't tweeting.
Now it's immediate, and now it's we see, any videos you see throughout the world, you see people wearing masks. It's a world problem now. It's not just the United States. It's not just Russia. It's not just China. It's a world problem. We're all in this together.
Well, we see that very, very sharply with the situation in China, in India, where, thank goodness, much of the rest of this country anyway is in at least the position to be able to turn to India and say, we're going to help you. And that's enlightened self-interest, because if it's people are getting sick in India, they're going to get sick everywhere. So, instantaneous information, it may be our salvation. Our guests on this 50th episode of the Behavioral Corner are our good friends and partners from Retreat Behavioral Health, Peter Schorr, who is founder CEO of Retreat Behavioral Health, and Ken Kosza, the chief operating officers. We have more. We're going to talk about the golden age, unfortunately, of depression in this country when we continue our conversation.
Studies show that 2020 has negatively affected the mental health of millions of Americans. That is why at Retreat, we work to provide comprehensive mental health programming through our Synergy Health programs. To learn more about Synergy and the comprehensive mental and behavioral health services we offer, call us today at 855-802-6600.
So, guys, how do you like the corner so far? By the way, there's a great bodega across the street where you can pick up, fruit juices and Spanish language newspapers and all kinds of stuff. It's a terrific neighborhood. We love it here. We're at the corner of What's Up.
What's happening?
I will tell you. I'll tell you quick. We interviewed a executive with the Philadelphia Phillies baseball team very early on in the pandemic. He was in lockdown. The teams weren't playing. We didn't know whether we'd have sports. I thought, well, what affects people's emotional well-being? Then I'm not going to have any baseball. So we had John Brazier on, and John was recording his end of this thing in his backyard. and there were birds. You could hear the birds
That's awesome.
tweeting. Back in my old radio days, I would have been freaking out. John's come back, get the birds out
I
here.
love that. Remember, I always wanted to have that after show where we're in the hut and we talk to John Brown about sports.
Exactly. Well,
everybody will listen to hear John Brown talk about
John
TV
Brown about sports. That's funny.
That's right. That's right. Let's talk about we know that it's almost self-evident. If you know anything about substance abuse, it's an isolating disease, cuts people off from their families and healthy support systems, and they wind up using the pandemic did that in spades, and resulted in the highest 1 year toll of overdoses. The number I have here is like 80-some thousand people. It's extraordinary. It's more people died of substance abuse overdoses than die on the nation's highways. And we know those reasons are self-obvious. The other big problem now, and I want to know whether you think it's actually a bigger problem or the same problem, and we have a mental health crisis in this country, an enormous mental health crisis that affects everything we talk about that's problematic. Certainly substance abuse, but when the arguments over guns come up, and the one side said, well, there's just too many guns, and the other side says, no, there's too many sick people. You can see where mental health touches it all. So people have called it an epidemic of depression. Peter, you must see lots of people on an outpatient basis who are suffering from things like that. What are we getting a sense of what besides the obvious, are there other things that are depressing people at this point in history? Because it seems like everybody's depressed.
Well, there's a lot of uncertainty. I think it's changed a little since the beginning of the pandemic, but there was so much uncertainty with economics, what was going on, and how many people would be losing their job. It's very nice for the government to give stimulus checks of $600 and $1,400 every couple of months, but people go through that in a couple of days. There's still a lot of uncertainty. A lot of uncertainty causes a lot of mental health issues, and that's something that's unfortunate during a pandemic where we don't know where we're going. Now we have a little more direction, so it's easing back a little. But in the height of that, there was no vaccine. We didn't know what was going to be. Everyone's talking about if you get COVID, you're going to die. Remember that? And now, we know people. Kenny and I know people who had COVID that didn't even know they had it. It's changed a lot, obviously, and we've become stronger. A good part of our population has been vaccinated, and we're starting to come out of this. But it's still a long way to go. You read about some states that are as bad as it was when it first started.
That's right.
That's right. That's going to cause again the uncertainty, and you're going to see a big spike in overdoses and mental health issues. We see people that have overdosed and died. We look at each other and it's like, how did that happen? This person was doing so good. An older person, in their 30s and 40s. What's going on? That's when you're feeling the tick of what's happening. That's when you know what's happening, when you see an older person is overdosing from a fentanyl overdose because of the pandemic that's going on.
Ken, we put a tragic number on the number of people who have died from the virus. We know that many other people have died from ancillary issues that are directly resulted of that. Suicide rates are through the roof. You're familiar with the phrase, I've seen it in so many articles, where they talk about deaths of despair, as though people just wake up with no apparent reason for feeling desperate and take their lives. It's not like that at all, is it?
No. It's definitely a process. And what we've seen over the last few years, as Peter talked about, the fentanyl crisis is a real paradigm shift in terms of the impact that drugs have on the brain, right? So you're seeing folks that are coming in now that have mental health issues, particularly depression, that may try a substance or try a drug, and maybe it's Xanax, maybe it's an opioid, and then they end up either overdosing on fentanyl or something like that has a significant impact on the brain. So you're seeing more of these young folks that the disease of despair is now becoming a disease of quick overdose due to depression. Like you said, you're self-medicating, and in the past, maybe you eventually got addicted to heroin and that went on for 10 or 15 years, but now that Xanax is laced with fentanyl, or it is a fentanyl pill. It's not even laced. Or, you know, you were taking opioids and that's where that went. So it is definitely a disease of process, a disease of time. And to treat it takes a very multifaceted approach, right? You're working with psychiatry, you're working with counseling, you're working with, like Peter said, higher levels of care like IOP. You're working with things like the DTMS machines. Brainsway, I think that you have had a session. Have you had an episode on the Brainsway on the show?
We haven't, because I haven't found the right person to talk about it.
Oh no, yeah, we need to. Maybe it's Dr. Klotz, Peter.
Okay.
Yeah. We have a handful of folks that are really understand the function of this service very well. But effectively, what it does is it's slight restructuring of the brain through a MRI-like magnetic pulse that affects the brain and gets the blood flow going and increases your glucose metabolism rates and things like that to trigger the brain. We've had a handful of folks use it, and we see really good outcomes. And Brainsway as a whole has had really, really good outcomes to treat depression. But it's DTMS, which stands for Deep Transcranial Magnetic Stimulation. DTMS.
These aren't microdoses of electric shock.
Yeah. So basically, what it's an MRI strength magnetic pulse. So it's a machine that hooks up to your brain, and it provides like this MRI strength magnetic pulse that goes through the helmet and then fires certain neurons in the brain. And what makes the DTMS technology different than the TMS is that it goes deeper into the brain, which reduces the amount of human user error. So when you're setting up the machine, the outcomes of TMS are really strong if you actually hit the part of the brain that is functioning, right? If you miss it, it doesn't work. So if you can get to the place where the problem is, you see really good outcomes. And at this point, typically insurance pays for that if you've had several failed attempts of medication. So this is somebody that you talked about that has the disease of despair. Maybe they've had chronic depression and they've just never been able to kick it. Maybe they've had a psych hospital stay or not, but they may never have even gotten that significant or severe. They've just dealt with depression and they've tried counseling, they've tried psychiatry, they've tried medicine, nothing really works. This has shown really good outcomes for those folks to kind of get another shot at something different. And again, the DTMS component is what makes it a little bit more unique in that it goes deeper and decreases the likelihood of user error.
I want to follow up with you on that and find somebody good to talk.
Let's have another episode on that.
Yourself.
But it's another way to treat depression.
Peter, let me ask you. You've been at this a long time, man and boy. You've seen a lot of changes. What's the most significant change you've seen in the area of your expertise, behavioral health, substance abuse? What has really shifted in terms of people's thinking or procedures?
Well, I think, and Ken touched on it, was the introduction of fentanyl into this country. At first, it was the replacement of people who were doing heroin, which it's another opiate, and people were using that. They understood that there was an opiate, there was a chance of them overdosing and things like that. But now it's worked its way into almost every single aspect of every drug there is. Yep. And like Kenny said, it's put in Xanax pills, it's put in cocaine, it's put in marijuana, it's everywhere. I mean,
affecting the profile, right, Peter, of the patient that you're then treating, right? There was a kind of a history that you would typically see for somebody seeking care, but by introducing that, you're really functionally changing them.
And that's if you get the chance to do that.
Right, if you get the chance at all, right?
Sometimes
fentanyl actually has a medicinal purpose.
Not the ones that are coming to the United States.
No, I know, I understand that.
Of course. Fentanyl is used as pain medication for people suffering from cancer, from all these inoperable diseases they have, and things that have been used forever. My mother, when she was
in China with the intent,
she used it.
Yeah. But I've been reading those stories as well, which I was shocked to find out. I understood that, the sources of illicit drugs thought, oh, look at this. We can spike our cheaper stuff with this. And actually the results are obvious. I had no idea that somebody buying, a Valium,
Xanax.
Buying that.
Very common in Xanax now.
Yeah, in Xanax.
They're not Xanax pills, they're fentanyl.
So people,
cocaine now is fentanyl.
Yep.
I mean, right. I'll give you an example. Like 2 months ago, I had someone working in my house and they left and they went to go to a neighbor's house. And I was just about to leave my house. I was getting in my car to drive. And my neighbor called me over and said, "You better get here quick." I go, "Why?" And I get there, and this electrician's helper was in distress. When I got there, he laid on the ground and went blue, stopped breathing. I started CPR on him. I didn't know what he took, but I did CPR for 11 minutes before the police came and they just watched me do CPR. But when the EMS came, they had to give him Narcan. But he thought he was taking cocaine.
Yeah. For people who are, my guess is that when people who think they're buying a benzodiazepine for a legitimate reason and it winds up being cut with fentanyl, they didn't get that from CVS or Walmart. Or people they're buying drugs online.
They're buying it for a legitimate reason. They're not buying it off the street and fentanyl is going to be in it.
But that's where they get it online, right?
Yeah, I mean, but they could also they could be buying from a friend. I mean, there's all different ways.
And that's happened.
Yeah. I mean, it could be. It's a scary proposition, right? We could have a whole show, a series on the scary proposition that is the fentanyl situation. It's not even a drug crisis; it's a fentanyl situation that we have in our country right now. That is, if you really think it all through, right, you're talking about a major conversation if it ever went beyond drugs, right?
And it's gotten into everything. So that's what's scary about it.
Well, I mean, there. I hate to use the phrase because it sounds so pointy-headed, but there are geopolitical considerations here.
Absolutely. What I'm saying, you could go anywhere with this, Steve. Think about it. If you're pulling somebody over and you see these numbers and we get desensitized to it, where they have enough fentanyl on them to kill 10 million people, and we don't even let that kind of sink in. That what are we saying right now? Right. It would be a lot of cocaine to be able to get to that. It'd be a lot of heroin to get to that number. And, in our minds, it's because it's been used on the illicit drug scene, and it's like you said, they're cutting it in, but they're not cutting it the way a pharmaceutical company's cutting. They're just taking a big pile, mixing it into a pile, and mixing the pile, so you don't know what you're getting. But obviously, that's from just a human safety, a public safety situation. It's fascinating. Yeah.
Well, and we better get out in front of it immediately. It's one thing to
get it out of the country.
It's one thing to have these gigantic conferences where trade representatives get together and argue over tariffs and who's bringing more steel in and taking less steel out. And somebody ought to stand up and go, "Listen, you want to do any business with us? Get that stuff. Keep that stuff from leaving, getting over here. We'll hold our end up. You got to hold up your end." That's long overdue in this country.
I can talk about that for hours, Steve.
Yeah. Oh, yeah. I'm going to let you guys go. I know you're busy. And we have to put this show together because we want it to coincide with exactly our 50th program. Again, well, you know how I feel. You guys have been the best. You gave us the mandate. We're working like crazy and loving it. This has been a real education for me, boy. The social media world was foreign to me. I'm learning more about it every day.
You're doing so.
I hope you guys appreciate the show. We really. We're proud of it. We're proud of our partners, with the people we've had, and we thank you so very much for your support. Appreciate the hell out of it.
Well, we're proud of what you're doing, Steve. We're proud of that you're getting the word out there. You're getting guests that are informative. People are learning about not only the disease of addiction, but many, many different topics. Because a lot of them just band together at the end of the day anyway. But you're doing a great job getting the people to talk about what's going on.
Well, no, I mean, thank you. But you did me a favor. Like I said, I've been in broadcasting for a long time. When I decided I still wanted to do something, I thought, well, I don't want to talk about that anymore. I sure don't want to talk about that anymore. There must be something worth talking about. And I found it, unfortunately, in people's sorrows about substance abuse. But, you guys and the people that help them opened up a whole new world for me. I learn every day. I learn something new every day. Peter Schorr, CEO, Retreat, and Ken Kosza, Chief Operating Officer. Thank you, guys.
Thanks, Steve.
Take care.
Take care, everybody.
See you all next time. Don't forget, you're supposed to, the deal where you follow us and you like us. And we really need, nobody likes critics, okay? But having said that, there's a function where you can review this program on iTunes. That's a big deal. And I'm tough. I got my skin is pretty thick. Tell us what you think of the Behavioral Corner, what you'd like to hear, what you don't want to hear any more of. That would be very, very helpful. And we'll look for you next time on the corner. Take care, everybody.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.